So, we've got a cracking end to what has been a fantastic day. And I have with me 4 people on the panel who are going to share their thoughts for 3 minutes on the future of personalisation, services, carers and digital engagement. We're then going to invite questions from you in the audience here, and we're inviting anybody on Twitter who'd like to ask our panel a question to share with us. So, on that note, we're going to start with Robert. 3 minutes on the future of personalisation. You're on.
Right, personalisation, to me, it's got to have inclusion. We've got to have ways of trying to make sure that the new services are around the citizen, so the citizen becomes in control, that we actually have a marriage and proper communication across all providers of care, and that the person becomes one of those providers of care, and that the carer understands what the levels of personalisation are going to be, so that if there are any problems in the delivery of that care, then they'll be able to make representation to make sure that the person does get the level of care that they need. It shouldn't be medical. Medical needs to support it, but it does need to be moving to much more of a supported self-care environment. I think that today we've heard a lot about technology, and I think technology can really help us to get that inclusion. I think we've got to find ways of how we find that for some of the most disadvantaged groups, particularly mental health and some of the older people who are perhaps at this moment not linked into technology. But I think there are real ways that we could help the older person to really understand how to use technology. And we heard examples that that could be done through a library service where people can be given help to try and find out how to use their technology in the most appropriate way. We need to use today's technology today, and we ought to move to tomorrow's technology as soon as we can and make it easy and simple, and then I think we can then end up with a sustainable NHS and social care system. Thank you.
Excellent. Thank you, Robert.
I'm being lazy. Okay, so I've just decided what personalisation is on the fly, so that's great. First thing I think is that we never really got to personalisation last time round, so we should probably stop a lot of that, strip it back and start again in many respects, because not a lot of it was very personal and human. It was actually a lot of automated personalisation. And so I think really what we've got now with the kind of tools available to us in digital and the approaches that we can take, it would be quite nice for us to actually start again from a very human perspective, and actually take people on a personalised journey through their requirements and resolving those, whether it's through being able to 3D print products or whatever it might be, that we can get to a real level of personalisation where previously we've just been buying big packages and making you choose something off the shelf, and then calling that personal, but it's not so much. For me, we've got to move beyond this sort of consultation culture that we've got in public services and move upstream on that a little bit and get into service design and co-design in a different way, in a way that actually fundamentally understands the lives that people are leading and supporting those lives on a very, very specific level, whereas consultation is essentially asking people about something that's a fait accompli, which we've been really good at in the past. And things like really personalising technology everywhere, technology in our clothes, kind of an end to this sort of artefact culture that we have, where you give people a thing and instead just try and weave it into their lives would be quite nice, so that they don't have like a GPS tracker in their left pocket and another thing in their right pocket and feel slightly like some weird cyborg walking along clunking with technology, but actually something that is a bit more natural in the technology sense. So that was my random brain.
Thank you, Dominic.
Hello, I'm Claire OT on Twitter. Some people have pointed out that I didn't introduce myself as Claire OT, so here I am. Yeah, first of all, I just wanted to say thank you to everybody who's been so willing to engage with all of these ideas and look at new ways of working. you know, if we're going to achieve this, it's going to be because of you making the changes that you need to in the way you work, and demanding the changes that you need to see in your workplace. So making those demands of your manager. You know, I'm trusted to do a safeguarding assessment. Why can't I be trusted to send a 140 character message to a service user that I used to know 5 years ago? You know, Caldecott 2 is about the fact that we have a duty to share information, not a duty to keep it to ourselves within our own team. So I think we all need to get on board with that. It's been so great to be able to see such a lot of people committing to this agenda. And while we have to think about digital inclusion of the communities that we work with, I really want to emphasise the workforce issues involved in the digital inclusion agenda, actually in health and social care organisations. I think it's fantastic that Kent has got together to create an event that really looks at that. So congratulations to all of you. You're at the forefront of this movement, and I think it's really important work that we've been doing today. But we all learn through play, so don't let this become onerous, another layer of bureaucracy, something else that we've got to tick off in a box. Digital is about fun, and we learn through play. So let's make it enjoyable for us and for the people that we work for. You know, this is how we're going to see the change.
And finally, James Lampert, the commissioning manager, and the man brave enough to bring in the Connected Care Network to run this event today.
Thanks, Shirley. One of the first things I must do, actually, I don't know if this is in my 3 minutes or not, but the team at Yecco, who have donated the mini iPad, which we'll be joining the raffle for soon, have made a plea, please, don't go home without a Yecco pen or a Yecco mug. So do feel free to come up and snatch them off the front here. I think there's still some off at the back too. So thank you very much to Yecco as well for all of your support. I just wanted, in terms of personalisation, I just was reflecting on some of the good things that I've heard today. It's probably quite a nice way of ending up the conference. So I've got 6 things that I've heard just through conversations I've had with other people. Some of the things that might come away from today, some of the smaller things which might happen and might make a difference to care here in Kent. First was I think something which came out of one of the workshops this morning, the mental health workshop, and then some subsequent connections that took place between some of those attendees, maybe around looking at how we can transfer some of the ideas in one of the apps around dementia. So maybe something might come of that. Secondly, in one of the workshops I was in around community connectedness, I heard a conversation going on between Mary who dropped by and one of the voluntary sector organisations down in Morning Marsh, trying to address social isolation and connecting people down there. The third thing, I think we've already heard from Care Opinion that we've got a meeting lined up now between KCC and Care Opinion, making sure that we carry on that conversation and think about what the opportunities might be to hear what people's stories are about the care they receive. The fourth one, and the fifth one actually, is some personal things I've heard from people. One is around thinking about how they're going to go and speak to their GP in a different kind of way, thinking about what kind of apps might be out there that they can then use and actually go to the GP and say, hey, look, this is information I want to share with you and I want to have a different kind of conversation to the one we've been having so far. The fifth one, somebody's dad who's shortly going to be moving into residential care is going to go ahead and set up Mindings, so I'm sure Stu will be very pleased to hear about that one. And then the final one was a conversation I was having with Yecco, again, just to finish with them, around the conversation they've had with one of the care homes, looking at how we can get the potential for tablet devices through using Yecco as a social platform so that people in care homes are more socially connected. So there's some great stuff. I'm sure that those are just the conversations I've had, and there's about 150 of us here. You've probably all heard 5 or 6 other conversations too.
Thank you, James.
While you're all thinking about challenging questions to ask the panel, I'm going to start with my request for a hot tip on learning from today in 140 characters from each of the panel that we can tweet out. One hot tip, the learning for you from today, Robert.
Don't accept any questions from Shirley.
Do you want want to
Well,
borrow a paper tweet?
no, tweet.
Right, I want to tweet, yes.
No, that's my learn to tweet.
Learn to tweet.
Learn to tweet, have conversations, and let's spread the word.
And can you just tell people your Twitter name so that they can attribute this quote to you?
Yeah, Robert for Stewart, Stewart. Thank you.
Thank you.
Talk to frontline practitioners when actually designing those services would probably be a good one, based on how many people I know who don't.
Thank you.
Make it fun for yourselves to learn about some of this stuff. Make it fun for the people that you're working with as well. We all learn through play. Nothing's changed from when we were in a sandpit years ago.
140 characters. Meet the people you tweet in real life. And hopefully, yeah, I think probably lots of nods around the room. So go beyond social networking and make it real. Go and meet people.
Thank you. Right, well done.
The first challenge. Okay, so we're now going to start taking questions from the floor. We've got our roving mic, hopefully. Anybody hands up would like to ask the panel a question? Okay, Nick, do you want to read it out?
Yeah, it's from Atwell's Home, and it says, what, if anything, will Kent do to deprofessionalise care, i.e. support ordinary people in helping others in their community?
Well, I think the first thing we want to do is to try and, as I say, shift the focus of care away from the professional and towards the individual, and actually trying to join up health and social care, but also the third sector, and learn how we can really use that and the private sector to drive change, because it's been very much a top-down solution before. We need to co-design it both with the clinicians, because we have to make it relevant for the clinicians, but more particularly and increasingly, we need to go back to our users and our patients and clients to understand what is the best service that they could have.
Thank you. Okay, on to Dominic. You might have some hot tips for Ken.
Okay, I'll have a go. Yeah, I think there's a huge amount we can do actually. We're really at the beginning of the conversations around, I don't know if it's necessarily deprofessionalising care, because I think there's a balance between the professional support that lots of people in the room here might be given. And maybe it's not professional support, but it's about qualified support. It's about making sure that people are being signposted in the right direction, that people are being given the best kinds of opportunities. I certainly think there's some work that needs to be done across the whole health and social care workforce, which I suppose reflecting on some of the discussions we've heard earlier, was how can you empower people living within communities to engage and do some of this stuff, actually, if the kind of professional organisations and private businesses and charities that they're trying to engage with aren't in tune with this stuff too. It's all very well giving people social media and the tools to do this stuff if there's kind of a black hole at the other end. So there's something to be done in terms of everybody moving along somehow at the same pace together.
Okay, thank you very much.
Sorry, there's one other thing I wanted to say, and that was one of the ways we can do this is by actually giving the person all of the information that's floating around the system about them, so that we go to a system, no information about me without me knowing about it, and we've got a project in Kent looking at how we could do that through a platform called Patients Know Best.
Indeed, thank you.
Okay, open to the floor. Hands up, question. Can you just say your name and where you're from before you ask your question, please? Thank you.
Yes. My name is Sandra Springett and I'm from AGK in Tunbridge Wells. And just following on from the deprofessionalisation, which I agree shouldn't happen too much, but I don't think it's even that. I mean, we talked about this from the group that we were in earlier with the Casserole project. And it's about, we're so risk averse. I'm as guilty as the next person, but it's, we won't let people do things or take risks because we know what's best for people. And that's kind of stifles some of this. I've heard people today worrying about people going on the internet because of what they might get up to on the internet. And we are, and things like the sort of self-stats and the other, care home for the learning disability. We're so terrified that something's going to go wrong. How do we kind of balance that? Because this balance you know, it's gone so far that way. We're just trying to protect people all the time when they don't really need protecting.
Okay, question for the panel. How do we balance risk and innovation and a very paternal view of professionals know best? Panel, over to you.
I think the first thing to highlight is that both of the examples you gave of Mid, South and Winterbourne, what the people needed protecting from was services. It wasn't risks out there, it was stuff that we're responsible for. And certainly to deal with those kinds of risks, sunlight is the best disinfectant. The fact is that people are having conversations about the care they get in hospital, they're having conversations about their dad's experience in a care home. It's all going on in social media. The only question is, are you listening to what's being said about you? Are you part of that conversation or are you not? So I'm all for empowering people to shout about what's going on, what their good experiences are, and where there is room for improvement, because it's only through listening to the experiences of people that are actually going through our systems day after day that we can learn and we can improve. We've all gone into this to provide an excellent service every time. So all you've got to do is unleash the potential of your staff to respond to that feedback. And care opinion and patient opinion are a big part of this. But you know, there's also responses on NHS choices, down to every GP practice, every dentist. You know, it's worth remembering that. And of course, your local health watch. Dominic.
For me, there's some comparisons to the tech world in that the tech world wouldn't move forward as fast as it does if it weren't for disruptive little startups doing things that big companies can't do, and actually treading a new path and showing a new way, and then unfortunately they're getting gobbled up by big companies or whatever, but hopefully that bit won't happen. But in our space, what we need to do as well is to create that space and find those people who are willing to take those risks in a controlled way, in a way that is actually reasonable and human and rather than institutional, where everybody's aware of the risks. The transparency point, totally right. As long as you know what you're going into and what all the rules of the game are, which is what we're honest about in Castle Rock, then I think there's no problem to that. But I can see why AGK or KCC or whoever might struggle a bit with taking those, but that's fine. Just make sure that you find the people who can take those risks and are willing to work in that space, and then you know, boost them when the time is right, or quietly move it aside if it doesn't work. So.
Yeah. I mean, I think the first thing is that we do need professionals to be professional. They've got to know what they're doing properly, and they've got to execute that in the most correct way. But I do think we've got to talk about some culture change here and a change in expectations. So my patient, who's a very difficult old man, came and said to me the other day, I said, I want you to do this. He said, of course I'll do it. And I said, I bet you won't. He said, I always do what the doctor says. And we've got to move from this idea that the doctor always knows what is best. The doctor tries to explain what he thinks is, what he or she thinks is best, but we've just got to change the model so that we actually can break down some of those providers, some of those barriers rather, and look at some different solutions, because we can't have more of the same. We can't even have the same. We can't even have the same. So we can't have more of the same, so we've got to have quite a bit of something different. And we've got to look at how those solutions are, and we've got to try and find a way of co-designing those solutions with both the professionals and the users.
So, a radical statement from the clinical lead, GP, we've got to move away from doctors know best. Interesting one. And I think, you know, Claire's comment about the are you listening in terms of balancing risk and innovation is fairly critical. I would say, I mean, one of the observations made by Dominic in the workshops was about Kent having a fund of little amounts of money to support innovation. Personally, I totally agree with that, because it doesn't, and it's something, I mean, Stewart and I run the Disruptive Social Care podcasts, and we used to contemplate how is it was sometimes easier to get £100,000 for an innovation than for people to get £10,000 to really kickstart what they were doing. You know, so I think one of the strong recommendations that I'm sure all the panel would agree with me, how can Kent set up an innovation fund with small amounts of money for all of you people inspired today to think, I want to do things differently. Okay, on to another question. Tom, if we...
Yes, sir, it's coming to you.
Thank you. Don't normally need a microphone, but thank you.
Could you say who you are?
I'm Tom Phillips, and for the purposes of this question, I'm freelance. What message would you give from today to elected local authority politicians, and how would you get it to them, given that they're one of the slowest groups to adopt social media?
Okay. Can anybody tell me how many Kent councillors are on Twitter? Are your local MPs on Twitter?
Councillors, it's about 50.
Right. 50 councillors on Twitter? 15. Right. 15 out of 84 councillors on Twitter. Presumably the MPs are on Twitter? Kent MPs are on Twitter? Okay, so, lovely question from Tom. We'll take it from you to start with, James. How do we encourage more engagement with our politicians?
And we'll work back around the panel.
Being an apolitical local government officer, I'll be careful about what I say. I mean, it's encouraging actually, isn't it, that there are 15 on Twitter, and I do know, actually I heard an anecdotal story that one of our cabinet members actually was monitoring some of the things which were being said around families and social care services only very recently, picked up an issue and came back to one of our customer care teams and asked them to pick it up, and it was traced back through the original post on Twitter. It's an anecdotal story, but actually I think there's something for us to learn in terms of how we're listening to what our customers are saying, and actually we probably shouldn't be reliant on elected members letting us know if we're getting it wrong. So I guess in terms of the conference actually happening today, it was really very much thanks to current member Roger Goff, who's got the health and education portfolio, and he was very supportive actually of today's events taking place, and it was actually endorsed by the Kent Health and Wellbeing Board back in January time when we took a paper to the board when it was in shadow form. So what I'm actually intending on doing is making sure we go back and have a proper conversation again at the Kent Health and Wellbeing Board in September time. We'll take a report with some of the outputs from the conference, have a conversation. Hopefully the leader of the council will also be at that meeting, cabinet member as well for adult social care and public health, and we can begin to have that kind of conversation with them around how we might want to take this forward, and how actually our elected members, representatives of the public, can get behind some of this stuff too. So in a lot of ways, actually, we're in quite a fortunate position. We've got good member-officer relationships where we can have those sorts of conversations. And hopefully, as a result of today, I can point you towards the kentdigicare hashtag. I should be tweeting Mr. Goff later on this evening and making sure he's catching up on what's been going on.
Thank you, James. Any other observations?
Yeah, first of all, I wanted to mention the fact that we do actually have a mechanism for translating what people in communities want to say about health and care services to elected members, and that's via your local health watch organisations. They all have a chair on the Health and Wellbeing Board, and they represent patients' views at those meetings. So that is one mechanism that's a bit separate to all of this digital stuff. But I just wanted to mention that there were some great photos circulating on Twitter a couple of weeks ago of policemen in Portugal or Spain who all had a name and a number, but they also had their Twitter handle on their uniforms so that you could tweet them, you could get in touch with them. What a brilliant way to connect with your local communities. As far as I'm concerned, I would be quite happy to go around with my name badge with my Twitter handle on it, and I don't see why it's any different for elected members. I think it would be absolutely brilliant to be that accountable to the public that you serve. If people are offensive, if they're horrible to you, you block them. You don't have to speak to them in real life, you don't have to speak to them in social media. But if people want to engage in conversation with you, if they want to offer a constructive criticism of something that you're involved with, I think we all have a responsibility to listen to those views, as well as give a mechanism for people to actually give us a compliment. Because most of the people commenting on patient opinion comment about positive stories, don't they? So we know that people desperately want to share their good experiences of care. There's nothing to be scared of. We talk to people all day. I certainly do. Talking online is just another way of doing that. That's all it is.
Well, I'd say really quickly is that you probably prototype in human timescales and get things scaled and delivered at county-wide level in political timescales, otherwise you'll never get anywhere. So just start stuff and ask for the members' permission and money later?
Well, the first is, of course, that you have allowed KCC to be involved in the organisation of this event, so we can feed that back. So, James, I can always be behind you if you need any help. No. The other thing is that what you need to know about Kent is also that KCC has developed local health and wellbeing boards that are linked to the different boroughs. So that's another mechanism of them being able to listen to some of these things. And then the other thing we've got to do is try and make sure that people are much more customer focused, so that we keep that message going at a county level as well. So all of those together might help to address that they might listen to the messages that are coming forward.
Okay, thank you. More questions? Lady in front here. So if you can say who you are and where you come from first.
I'm Teresa. I'm here as a service user in the mental health situation. I've written it down, otherwise I will ramble. So basically, from my own personal experience, for patients, it's often professionals who pose the most barriers to accessing technological ideas or perhaps sort of moulding your own care. So, for example, recently I was offered a vocational assessment to help me find work. Well, that's fantastic, but what they were offering was something for someone who's never touched a computer before, and I'm now on Twitter, on Facebook, on everything. But what I need is someone to help me use those tools that I use to find work, because people do find work on Twitter, on LinkedIn, on all these things, but I need the support to feed into it. So anybody who can help me with that, please speak to me. But basically, what I'd like to ask the panel is how can professionals go back to work and actually change this for patients? How are they actually going to, what's a proactive thing that professionals can go and do tomorrow and say to their line managers and actually do from today?
Okay, two challenges actually. I mean, one, what can you do from today? And a secondary question about employment support and using the well, but that's equally important. Unless people can see the benefits of using technology and social media, why would they? And that's a really, really strong benefit. So back to the panel.
I think it's a great question. I mean, obviously, I don't think the professionals are going to change tomorrow as a result of today. But we can start a journey, and we can understand that, as I've said, we have to get a message going forward across the whole of the system, that the system has got to change, and that we've got to move to supporting and having a much more supported self-care model. But that does include some culture change, and there's a lot of professionals out there, and some of them are going to be resistant to that change. But we've just got to keep going with the message that we've got to change to make this a sustainable NHS and social care system. So it's our duty from today to go forward to try and help that to happen.
I'd like to see this happen elsewhere. We work all over the place, so that would be quite fun to do. And on top of that, just to continue working with the enthusiasts, really. I think it's enough to create a passionate group of motivated professionals. Sod the rest, just work with the willing and make it happen. They'll want to play eventually when they see that it's the show to be in town. So.
I used to be really kind of compassionate and understanding about people that struggled with online technologies and work in health and care. And over the last few years, I've become a little bit more hardcore, and I now say to people, do you have an exit strategy for the next year or two? Because if not, you need to learn these skills, okay? And it needs to be in everybody's knowledge and skills framework, or whatever the equivalent is in social care, that we are actually addressing our digital skills. We're all health and social care workers. We can all do a little assessment, a self-assessment of our digital skills. We can write a piece of reflection about where we're at now. We can give ourselves a couple of goals, because we're all on a personal journey. We've all got to learn at our own pace. We can all give ourselves a couple of goals of things that we want to learn over the next 3 or 6 months, revisit that in 3 or 6 months' time. I think that if everybody in this room committed to doing that, I think that would be a massive change in Kent. In terms of your, and that isn't just advice in Kent, I say the same thing everywhere I go. I think the people here are fantastic. The other part of your question was about vocational rehab using technology tools. I identified this gap in the market, and that's part of the reason why I set up my startup, which is an online recovery college, which focuses around offering vocational rehab and peer support for people that have experienced mental health crisis. So I think you're right that there are ways and means of offering these vocational rehab services, because I'm an OT, and I would like to see those being delivered as a matter of course in services, but we're not there yet. We're not going to be there. We're not going to have capacity in the workforce to do that for some time. So I think, like Dominic said, you know, in these cases, sometimes it's good to just give a boost to startups, social enterprises, companies that are actually taking those risks and actually trying to do that.
I think from my perspective, it's kind of on the commissioning side of stuff. So my effort has been to bring you all together here today. So in some ways, I just want to throw it back out to everybody here in the room, because you're all enthusiastic. You're all the kind of, you know, the first people that registered for the events and said you'd like to come. So actually, I think if, you know, the bundle of energy that we've got here can be translated into something tomorrow, and you know, if all of you at least do one thing different, or tell 5 other people about today, and point them to some of the resources which will be on the kent.gov website, and I know also on Shirley's website as well, then hopefully some good things will come of this, some very immediate things as we work together, I think, in the future on some of the more strategic, bigger stuff.
Okay, we've probably got time for a couple more questions from the floor. Or have we got anything on Twitter? Right, people at the back there, we've got Russ and Chat next.
Russ and Chat next to him. I say once again, can you say who you are and where you come from before asking the question? Thanks. If we take both of them at the same time, so we'll have a double whammy on the panel. Thanks.
Hello, I'm Russell from CarePet, but I want to take my CarePet hat off for this question really and talk to you as a user of services. Now, going back right to the beginning to the risk that people were talking about, the risk is pretty much mine to take as a direct payments user, and to be really honest, some of the worst experiences I've had have been with agencies and organised carers. The best experience I've had with people that haven't ever been carers before. So I think it's about managing that risk. But my big question really is, how can we make the role of carer more attractive? The wages in Coventry are ridiculously low. It's £6.75 an hour, and we're expecting skilled, qualified, caring people for less money than you actually earn in Tesco's on a checkout.
Stephen Alston from Campbell. We've talked and heard a lot today about services for adults and quite a bit about services for older adults. I just wondered what the panel thought the role of young people is in all of this, because I think we'd all agree that young people are perhaps the most tech savvy in the country, on the planet, and often have the most innovative ideas. And obviously, you know, over the next 10 years, they're going to become commissioners. Some of them sadly will become service users. What role do you think they've got at this stage to inspire us?
Okay, thank you. Two really crunchy questions to end with. How can we make the role of a carer more attractive, and what's the role of young people? And we have only got about 10 minutes. Okay, over to the panel.
Well, I'll take the first one first. I think the most important thing is to value the carer and to make sure that the carer is involved also in the determination of the care package that should be delivered. And I think that we could use some of that by having a better use of technology for them to be able to use that, and also perhaps using technology and video conferencing and webcams for them to actually be able to be engaged and involved in the person's care in a much more intimate way, with not necessarily being with the person all of the time. So I think there are very different ways that we could approach how the caring solution is delivered. And obviously it has to go back to being suitable for the individual themselves. But I think whether or not we can do anything about the financial side of it, I guess is a bit out of our hands at the moment. But we certainly need to value carers much more, because they are so crucial to the care of people. With regards to young people, I think we've got to find ways that people a lot younger than me of being able to help us inform some of these solutions, and certainly they can be part of the solution. There's a very interesting thing that's going on locally in my area, where they're taking the schools into a dementia home and getting the children, the school kids, to be involved with those people, to understand them, but also then to contribute to, giving them much more of a focus and actually giving some motivation. So that's one way that we've managed to do about including young people in this system.
Okay, thank you, Dominic.
So I'll probably just answer randomly rather than directly to the questions. So on employment generally, I think there's a massive opportunity for sort of small pocketed bits of work that can actually add up to a fair bit of money and support for people, not just in carers, but I'm thinking around shopper, as I mentioned in my presentation, around how you could have a distributed home working network of people with disabilities actually working in that situation to support their peers. I think would generate an interesting income for people, and I just don't think we're being creative enough around how the internet can bring wealth to individuals, and there's a huge opportunity there. The youth side of things, I mean, we've generally everything's moved towards the family as a thing, so I would imagine that young people have an inevitable role to play in every part of this, I think, in a positive way. I would just guard against assuming that all young people are born with a silicon chip in their brains and know everything there is to know about digital, because from experiences we've had from, we ran an open challenge event which was all about trying to make the web more accessible for the over 60s, and we ended up with people who were over 60 coding by the end of 2 days. And on the other hand, we ran an open innovation event for young people who were not in employment, education and training, who said quite clearly that they were off Facebook because they hated being bullied and that it wasn't really their bag, and they hate Twitter because it's just full of egotists who like talking about how great they are. And so I think it's a little bit more nuanced than young can help old. I think it's a lot more around individuals and giving people a chance to grow, really.
Russ, I just wanted to say that I really, really share your concern about this, because when I was presented with a personal budget, my suggestion was that I'd rather have fewer hours of care but pay my carer much more in order to bring it up to a living wage and for them to have a quality of life that made them more able to deliver my care. And I was told that that wouldn't pass the funding panel. So I'm not sure at what level those changes have to happen, but I share your concern. We want a professionalised and committed network of people delivering care, and yet everything about our society doesn't say that we value what they do. And I'm sure we all individually would agree that we do. And I certainly would be willing and able to pay a premium to supplement somebody's wage to a small degree and make a little bit of difference to their lives. But I take on board Dominic's point that perhaps we have to be a little bit more creative about patching in support for people, and I think your idea about shopper is great. You can already use things like TaskRabbit and ideas like that to do little bits and pieces of work. And again, with my startup, it was very much designed around the idea that I know that disabled people are often excluded from the workplace, and so I wanted to make sure that I was developing a solution that actually would provide employment to people that was, decently paid, gave them really good experience, and that they were able to do from their home using an internet connection. But I want to also talk about the idea about our responsibility as employers using personal budgets in health and social care. The skills that are required to operate a personal budget, probably the same skills that you would require to run a small business or to manage a small team. So actually we are expecting people to develop skills at a really high level in order to be able to manage personalisation in the way it's conceived at the moment. And I would really like to see us having a greater aspiration and a greater expectation of the people that we work for, and actually support them into roles that are suitable for them and that are accessible to them, and that are actually going to pay them some decent income. Because wherever it's possible, I think that is probably going to be the best way to give them the money boost that they need in order to patch in the care that they want to pay a premium for.
Being at the end, I always kind of have my thunder stolen. All the things I was going to mention, everybody's done. I was going to mention some of the conversations we're having locally in Kent with our domiciliary care sector around living wage, and that's the kind of thing. Actually, that's a real conversation that we've begun to have. I think the other part around carers either working within residential care or within care homes is around training and workforce development. And actually, I mean, if any of us are doing a job, we want to do it really well, don't we? And we would like to take opportunities that exist for our own personal development. So there's been quite a lot of stuff, if you read any of the health and social care press, around the need to make sure that our unqualified staff are well trained and skilled to be able to do the things which they need to be able to do to deliver really good quality care. And it's quite heartening, actually. One of the tweets I think I've seen over the last day or two, the chief executive of Stoke Trent Partnership Trust has actually set up a healthcare assistant academy within the organisation in order to develop staff. So there's some really good stuff coming out around at the moment in response to some of the Francis report stuff and some of the other things we've heard about Staffordshire and so on. Moving on to the second question around sort of young people, there's a whole bunch of stuff. I think there are some examples of good things going on. Again, locally, just to plug for the people that weren't in my session this morning, hashtag Transformed by You is a local competition, actually. It's open to anybody across the UK, but focusing on Kent, looking at how we can improve neighbourhoods, can improve the health and well-being of local people, improve access to reading, arts and culture. There's £9,000 up for grabs for entrepreneurs and innovators in terms of taking some of those ideas that any of us actually in the room today could be submitting online and turning those into real prototypes with views to taking to market. And the connection there with younger people is actually about 250 students, undergraduate students in Kent universities are going to be helping to actually put some of that stuff together. So it's around how you can take some of these real bright people that actually have been brought up using the likes of Facebook and Twitter and programming apps and all those sorts of things themselves. Actually, by the time they get to university, now they're looking for something a bit more, something a bit challenging. And actually, it's not about how do you do that stuff, but how do you turn it into something that's really useful for people in the communities. Three other things I'll just mention in relation to stuff to have a look at. Try Life is another great example of a product that's been put together for younger people. Basically, it's a bit like, for those of you that are into Hollyoaks and things, I'm not. But it basically plays out scenarios online. So you've got young actors who come forward, so they've got an opportunity to have a go at acting, a bit of a limelight. But there are different scenarios played out. So for those of you that might remember the old adventure game books, this happens, which options choose A, B or C, go to page 5, go to page 10. Actually, you can do that all online. And it gives people the opportunity to test out, is it a good idea to, drink too much one night? Is it a good idea to have, try these drugs out? Is it a good idea to sleep with your partner's best friend or something? So, those are the sorts of things you can try out on Try Life and see what the consequences might be. I'll give Yeko another plug because they're doing some really great stuff with young carers, supporting young carers, so another thing I'll look at. And a new service that was launched, an online support and counselling service called Mindful, that's MINDFULL, that was launched last week. I think David Campbell was quite interested in that one. Locally, sorry? Don't put people off. Locally, we're doing some great work around dementia-friendly communities, intergenerational work. So we've got great examples. We've had kids in schools going into care homes and working with older people. Dementia Diaries is something, we'll put some links up around that, just been published. So Emma, sitting over there, wave. There's a Dementia Diary, so go and speak to her before you go home if you want to have a look at that. So yeah, that's probably enough for me. There's loads of good examples of things going on now, but still, of course, so much more we can do.
You want to mention my young people? Very quickly, yes.
Just wanted to cover, because I forgot completely to mention young people. I think whenever I'm thinking about technology and digital tools and social media, it's really important to just remember these are just more tools in the toolbox. What we're actually talking about is involving communities and individuals in managing their conditions and in connecting with people in their communities. These are just tools around that kind of work that we want to do. Young people are already using these various spaces, and quite frankly, they could do with a bit of help and support from us, really. They're there on Ask FM or Facebook getting bullied, while youth workers, with a few notable exceptions, are not in these spaces offering support, helping people to understand where the lines are and how to protect yourself. It would be great to see us offering closed Facebook groups to groups of young people that we're working with. Or, Twitter chats about sexual health in Kent. I ideas for engaging young people in actually solving some of these issues, because if we're serious about involvement, we mean all communities, no matter what their age.
Thank you. Thank you very much, panel. Okay, looks like we're at the end of the questions. Well, I'd just like to pick up on something that James was saying. For me, today is the start of the conversation, it's not the end. And so many thoughts and ideas have been shared online, but just to sort of give people a recap, we have all the resources from the workshops. They are all online at the Kent Council site. We're going to have a story fight of tweets for kentdigicare, which Mr. Clark is kindly providing. So you'll be able to run through that. And for those of you who've never seen Storify, this will be an absolutely amazing experience, anything you missed. The recordings will be up on YouTube. We'll be having a look at the analytics for the day, how popular has the hashtag been, what conversations have been happening. There's already, as James mentioned, already stuff on my blog. James has done a guest post. If anybody else is going to write a post about their experiences today, if you include me in it, I'm actually going to collect all the posts written about your experiences today, so that we've got them in one place. So if there's some of you, have we got any avid bloggers here? I think I'm going to put my hand up, you're going to be joking. Excellent, we have. Yeah, right, okay. So, so encouragement about it being the start of the conversation is that people are going to write about it, their experiences, good, bad, challenging, doesn't matter, and we will continue to collect them. We'll be doing a very brief report to Kent about the key messages from today, and your evaluation forms are also a very, very important part of thinking about how we go forward with this. So, key message, be brave, communicate, share. And on the sharing note, and we once again big thanks to Echo, we have now got to the little moment of the day when we're going to have the prize draw. So can I invite Robert to draw the winning ticket? Sorry, I'm wrong. A big thank you to the panel for responding to all these challenging lessons. A big round of applause, please.
The number 32 is the lucky winner.
32? Okay, can the person come to the front and we'll...
Robert, you need to come up here. You need to go up here. Come here.
Oh, brilliant.
Yeah, I'm being deserved over here.
And can I invite Robert just to give us a few final words before we finish the conference for today?
Wow. What a great day. What a great day for technology. What a great day for us to join up everything, and let's join up the care. And let's go away and really make a difference, because I think it's our duty for the people of Kent, but also the people of the country, to try and do things in a different way. We've heard a lot about revolution. Well, let's keep the revolution going, particularly the technology revolution, and perhaps we can try and see if we can do something about the bureaucracy that has also been mentioned today. We've got to try and integrate all of these services together, and I think we've got a real opportunity to do that, particularly if we put the person at the centre of everything that we're trying to do and try and co-design it with that person. But most importantly, let's try and communicate so that all providers of care actually communicate together and include the citizen at the centre of that. I've heard a lot about inclusion today, and I'm really encouraged about that because I think it's a really important message to everyone out there that we have to be really mindful of that. And I think we ought to be trying to build some additional community capacity to try and do things in a different way. We need to continue the networking that started today, and I managed to succeed in some of the tasks that was given to me by Shirley. The first is that I have met many more than 5 people, and many more than 5 people that I hope I'll carry on meeting, because I've now also become a tweeter. So that's part of my exercise. And I'd really like to finish really by thanking all of the speakers today for helping and giving us such a great insight into the way that the Digi revolution needs to continue. I'd also like to thank James and Mick and their team for putting on this conference, because I think it has been very, very successful. And really, I'd like to thank all of you for coming, because you have been the inspiration, and you've certainly been an inspiration to me. So thank you all very much. And the last thing to do is to wish you a safe journey home. So I think I've just about finished on time. So.
Excellent. Thank you, everyone.